Good morning, everyone, and welcome to this webinar, Stoneleigh Fellows in Action. Today, we're going to be talking about the effect of the COVID-19 pandemic on environmental stressors for youth, and especially those that are pre-existing. We already know that too many of our youth are coping with issues of community violence or domestic violence, living in substandard housing, having trouble accessing food, underemployment or unemployment, as well as problems accessing educational opportunities, healthcare. All of these have been ongoing environmental stressors for too many of our young people, and now they are facing the additional challenge of coping with this pandemic. So even as these various systems try to adapt how they reach and serve young people themselves are dealing with changes in the nature of the problems they're confronting, the severity of those problems, and how they show up. So today we have three Stoneleigh Fellows: Dr. Ruth Abaya, Dr. Vincent Reyna, and Dr. Abigail Gray, and each of them have been working in a system that has already been dealing with some of the stressors that we've been talking about. They're going to share with us some of their early observations about how the COVID-19 pandemic has affected the populations that they're working with, how it's changing or perhaps adding to our understanding about how those environmental and other stressors affect young people, and very importantly, perhaps learning new opportunities to innovate about how we serve young people. So I'm going to turn it over to Mark for just a moment, who's going to cover some of the logistics of the webinar, and then we'll dive into the agenda. Mark?
Thank you, Patrick. Hello, everyone, and thank you for joining us. We will be setting aside some time at the end of today's discussion for audience questions. Throughout the session, if you have a question for any of the speakers, please click on the Q&A button that appears at the bottom of your Zoom window and type your question into the box at any time. Please include your name and organization with your question so that we can identify you for the speakers during the Q&A. Thank you, and please enjoy today's convening.
Terrific. So I'm going to introduce each of our panelists as they speak. They're going to each spend about 5 minutes summarizing some of their observations. And then after we've heard from all three panelists, there are a few discussion questions that I'd like to raise with them. And as Mark said, hopefully you'll also be contributing some questions that we can discuss further with them. So we're going to start with Dr. Ruth Abaya. Dr. Abaya is a pediatrician and an emergency room physician. Dr. Abaya has been working with Children's Hospital of Philadelphia and with the Philadelphia Department of Public Health on a real interesting project focusing on gun violence prevention. Dr. Abaya is working on lots of different aspects of that challenge, but in this particular project, she is working to create a registry of all fatal and non-fatal gun injuries in the city, and looking at the characteristics of the young people involved in these gun injuries, the systems that they're touching or touching them, as an effort to develop prevention strategies. So I'm going to turn it over to Dr. Abaya, who's going to make about 5 minutes of introductory remarks. Dr. Abaya?
Thank you so much, Patrick, and thanks to Stoneleigh for hosting this. Thank you all for joining. So as you said, Patrick, so my interest is in gun violence prevention. I manage the injury prevention program at the health department, but I'm also a pediatrician. So I got into this work by directly witnessing the effects of gun violence, particularly on young people, and how those effects kind of reverberated throughout their lives. And so that's been the foundation of my interest and kind of been what's been propelling me forward ever since. And our program is focused on gun violence prevention pretty unapologetically right now, because that's been the injury prevention conundrum that our city has been facing. I think one of the main points that I wanted to be sure to make in regards to how this is affecting our work and how we think about how epidemics layer in populations of disadvantage is just how much the determinants that we make reference to so often really drive it's not really an epidemic, it's really more of a chronic endemic problem of gun violence in Philadelphia and in other regions of the country. And how we are given an opportunity through COVID-19 to see how these layers of disadvantage really kind of cripple populations that have already been crippled. And how when we talk about doing violence prevention, we want to focus on the things that we know will work. We like to focus on evidence-based solutions, and that should continue to be our efforts, but it's not too heavy of a lift. And in fact, it's a necessity to also consider these drivers of violence. I think sometimes they feel like wicked and entrenched problems and things that we can't overcome, things like poverty and systemic racism, which feel, I think, larger than what we can take on. But I think we are compelled in moments like this to realize that it's not larger than what we can take on. And in fact, if we're serious about the smaller problem, we have to address the bigger one. I also I'm choosing to see this as an opportunity. And in that vein, I'm very grateful for the opportunity to reiterate the fact that gun violence is a public health crisis. I think there's been a lot of lip service given to that notion over the last 10 years or so, but it's been hard to know how to operationalize it because for so long, solutions to firearm violence have been entrenched in criminal justice. And while criminal justice certainly has a role to play, I think that thinking about it as a transmissible or communicable disease, thinking about it as something that is in some ways heritable, thinking about ways in which it's transmitted from person to person and how it is exacerbated by kind of underlying health conditions or underlying social conditions. I think that framing is extremely powerful, both for securing the resources needed to kind of fight this fight, for bringing in the stakeholders that are most important in fighting this fight, and also for creating sustainable systems that make a difference. So the premise of building a registry, that idea, is based on how we treat a number of other things. So we have a registry of COVID-19 patients right now, right? We have a registry of people who are affected by rare, communicable or infectious diseases that are of concern and that we worry about. We track those individuals, we track their contacts, we follow their progress over time. So there's no reason we shouldn't do something similar for those who are affected by gun violence if we truly think it's a public health problem. So that's been, I think, the underpinnings of the work that we planned. And I think COVID-19 helps us to kind of emphasize and underscore that framing, and then focus on the underlying issues that we think may be driving things, and get serious about fixing them.
Great, thank you very much. We'll come back to you with some questions and get a little deeper into this. I'm going to now turn to Dr. Abby Gray, who is currently the Deputy Chief of School Climate and Safety for the Philadelphia School District. She is a previous Stoneleigh Fellow and a senior researcher at the University of Pennsylvania Consortium for Policy Research and Education. As part of her fellowship, she worked with the district to set up a research practice partnership on improving school climate. So turning it over to Dr. Gray.
Hi, thank you. Thank you very much for having me. I'm excited to have a chance to talk about this really pressing set of issues that are very interrelated in this really critical moment. So from my perspective, I think what I want to really emphasize here is that we know that whether we're talking about traditional schools or whether we're talking about places of virtual learning, such as we are currently working to develop and support, these cannot and should not be solely focused on academic learning. And I think, in fact, in this moment, it is becoming starkly clear that schools cannot and should not even have as their primary focus necessarily academic learning. Rather, schools need to be welcoming, positive places where all students can experience a sense of being known, a sense of belonging, and a sense of engagement. And this is always life or death. Keeping kids engaged in school is always a life or death matter, but especially in a moment like now, where all our kids in our city are experiencing, like everyone, intense trauma. And that trauma, the underlying trauma that many of them live with every day, is now being exacerbated by the fact that they are physically removed from their peers, from their teachers, and from the schools that were a primary central place of support, place of feeding, place where they could know and be known and engage and participate in both intellectual and emotional and social growth. We are seeing our work in our office has shifted, and in the district in general, from thinking about how do we provide that kind of welcoming environment and that kind of opportunity for engagement in physical buildings to how do we do that in a virtual online environment. And in doing that, we have developed and are continuing to develop amazing sets of resources for teachers, for administrators, for families, to try to help kids be engaged with their school communities, even in the absence of a physical building. And we see that as both a critical need right now, but also an opportunity, because I believe that it's shining a light on the need for a focus on social emotional learning and connection, and within all schools, and certainly within our schools, that I don't believe is going to go away or disappear from the radar screen when we do eventually have the opportunity to re-engage in physical buildings. So I think, you know, my work has been for years in alignment with others on this panel and others in our community, our Stoneleigh community, very much about altering the trajectory of young people's lives, in part by helping them to avoid gun violence, to avoid criminal justice involvement. And we know that schools are a critical link in that. The kids who are engaged in school, who have strong relationships with teachers and others in their schools, who have positive environments in which to learn, are far less likely to experience dropout, to experience criminal justice involvement, to be involved in gun violence down the road. So I think that COVID or not COVID, but particularly during a moment that we are having this traumatic, disruptive event in all of our lives, that focus on what kind of places we need schools to be and on what are the resources we need in order to make that happen is absolutely critical.
Great, thank you very much. I'm going to now turn to Dr. Vince Reyna. He is an assistant professor at the University of Pennsylvania with the Department of City and Regional Planning. He's been working with a consortium that includes the School of Design at the university, the Philadelphia Housing Authority, the Department of Planning and Development, and a nonprofit organization called LISC, which is the Local Initiative Support Corporation. They've been working on housing policies impact on youth. So I'm going to turn it over to Dr. Reyna.
Thank you very much. And so, as many of you likely know on this call, we've had a national housing affordability problem for quite some time. If you look nationally in 2018, at households making less than $20,000, only 1% of them were spending 20% or less of their income on housing. 88% of them, 88% of renters in that income band were spending over 30% of their income on housing, and a large share were spending over 50%. That reality was very much true in Philadelphia as well. In the recent housing action plan that was released by the city of Philadelphia, they highlighted that there's over 150,000 households who are housing cost burden, a large share of whom are severely house cost burden in the city of Philadelphia alone, and that's not even considering issues of housing conditions and other things that are related to that. So we had a context of a severe housing affordability problem. And then COVID came along and highlighted that even more. It highlights the precarity of a large share of Philadelphians and nationally residents' housing precarity. And it also highlights an important reality, which is kind of the focus of my fellowship, which is that housing isn't just about housing. It's about a broad set of outcomes that are related to housing. Housing instability is directly connected to youth's ability to attend school, to excel in school. Where that housing is located it directly affects their exposure to school quality, exposure to gun violence, all of these kind of things that are kind of a broad set of outcomes. And I think in many ways, prior to COVID, what we've done nationally for quite some time is we've put housing instability as an idiosyncratic issue that is a function of people's behavior, when in fact it's often a function of structural realities that unfortunately disproportionately fall on low-income residents and often fall on minority communities that then compound over time. And so in some ways, COVID exposes everyone to this kind of instability shock and highlights the importance of housing at this very moment. and how it connects to these broader set of outcomes. And the hope is that this current moment also exposes to people that these shocks are shocks that certain groups kind of face persistently, and it's not by virtue of their choices or actions. I think this moment also highlights a real distinct reality, which is that we have no housing safety nets as a country, and limited housing supports on the federal level that then translate down to the local level. As a result, localities are forced to develop programs with their own resources to address issues of housing instability that often aren't even close to meeting the need. So just yesterday or Tuesday, the city of Philadelphia launched its COVID rental response, COVID rental assistance program. The applications are open. I encourage you to spread the word. They're open until Saturday. You know, the expectation here, quite honestly, is that demand for it will probably exceed the amount of dollars that they have to actually allocate all these resources. We hope that's not the case, but you know, when we look at the scale of the need and we look at the limited kind of federal support and decreasing local dollars for this, there's a distinct challenge here, right? And so I think this moment highlights, one, the importance of housing, two, the lack of safety nets we have in place, three, the lack of federal supports to really address housing. We're just seeing some talk about housing becoming one of the responses at a federal level through policy and programs and increased funding through specifically rent relief programs, but it's uncertain whether and how that'll pass. And within that, I would say there's also kind of structural judgment values still ingrained in federal resources that then kind of affect the way programs can actually operate and who they can serve at a local level and how they serve those populations. So that's all to say that, you know, housing precarity has been something that has been present for quite some time. And to me, COVID really highlights this, right? But just as importantly, it highlights really how limited the tools we have there are to respond to this. I will say, in partnering with the city of Philadelphia, I've been really impressed with the all hands on deck approach that allowed them to be at the forefront of developing a local rental assistance program that they've just launched that is going to be a tremendous resource for residents. But I think everyone can squarely agree that the impact of COVID is being seen already and will persist over time. And it'll particularly persist for communities that unfortunately often receive the least amount of resources after these kind of shocks subside a bit. They still persist there. And so we have to hope that, you know, what we're doing here is establishing the groundwork for viewing the broader context of housing, importance of housing on a broad set of outcomes, particularly for youth, and that this leads to kind of long-term and sustained support that increases housing stability and reduces housing precarity for youth in Philadelphia and across the country.
Terrific. Thank you. Thank you very much. We're now going to turn to some discussion questions, and I'll be asking each of our panelists to respond to a series of questions, but there's kind of an overarching theme that I'm picking up here, and that is the kind of layering or the intersections of each of these three areas, whether you're talking about public health and gun violence, education, especially social emotional education, and housing. So, you know, we know that gun violence is a major source of trauma for students, and that affects their learning, it affects the school climate. We know that responses to student trauma, if they become punitive and certainly if they become exclusionary, can lead to students dropping out of school, leaving school entirely, and upping the risk that they will get caught up in street violence. We know that housing insecurity is a major factor in family mobility. And when you look at school achievement, we see that frequent moves on the part of a family are correlated with significant negative impacts on educational outcomes, especially with multiple moves that require changes in where they attend school. And obviously, families will move to escape gun violence, which again affects both their educational outcomes and housing insecurities and so on. And again, these are only three of the many factors that are layers of disadvantage and barriers that families and young people confront. So as we have a discussion with the panelists, I'll be interested in any observations they have about those intersections and about efforts that you've seen in your work to address those multiple layers of disadvantage and barriers for young people and families. I'm going to start with Ruth and just ask in a broad way what you're seeing as a result of the COVID-19 pandemic in terms of patterns of gun violence in Philadelphia and in other cities. I mean, obviously, the general public sees the pandemic as a critical public health issue. As you've pointed out, gun violence is another critical and grave public health crisis in many places, certainly including Philadelphia. So how has the pandemic affected patterns and trends that you're seeing in gun violence in Philadelphia and elsewhere, if you're able to see them at this point?
Sure. So even though any information that we have is certainly early, it's already concerning. Many of you, I think, are aware that firearm violence has continued unabated, both nationally and here in Philadelphia since the onset of the pandemic, in spite of social distancing and in spite of the public restrictions that have been announced. So nationally, there's been a decline in a variety of types of crime, including in some cities, violent crime. And that's also true here in Philadelphia. Gun violence seems to be an exception to this rule. So the first couple of weeks of April were the worst of the year as far as number of shooting deaths nationally, in spite of the fact that most places had movement restrictions in place at that time. So definitely concerning. This is probably multifactorial. So a lot of cities have cited limitations in their ability to police as they normally do. And they've also noted some significant kind of staffing difficulties as police officers are part of the front line of COVID response and are at increased risk, therefore, of contracting the virus. And so that has been one factor. But as we know, policing is only one part of the gun violence reduction work that we need to see. So when we talk about prevention, which is much more near and dear, I think, to my heart, we have seen that a lot of the evidence-based programming is significantly crippled or eliminated in the setting of COVID-19. There isn't enough personal protective equipment for violence interrupters and others to go out and do in-person interventions to do that work. And if they do it with some risk of harm. Those who do go out are finding that their attention is kind of divided, because in addition to needing to intervene on any pending or acute crises that could erupt into gun violence or providing kind of counseling around gun violence reduction, people have questions about COVID-19. People are worried about COVID-19, and they feel that they need to respond to that need, especially if they are the face of the government or the face of kind of the city when they come to these individuals. Digital work is really hard to do in this population. It's not really how this work was developed. I'm thinking about cure violence model type interventions and focused deterrence or group violence interventions and things that Philadelphia has and or was building to respond to violence on the ground. It's very hard to do that work. You need access to devices, you need consistent access to the internet, and it really eliminates a lot of the power of that work when you're not able to do it face-to-face. And then when you think about the challenges of a global pandemic, including things like the financial strain, the fact that the health risks for developing severe COVID-19 are also unequally distributed in populations that are known to have high rates of gun violence, the necessary budget cuts for other services, so not just for violence intervention services, but for other city services that target those communities, you can see how the problem would be compounded and exacerbated. It's also not clear that this message of social distancing has been effectively communicated to all kind of facets of the population. First of all, social distancing is a privilege, remote work is a privilege, and that privilege is not evenly distributed. But even understanding and trusting the message, depending on who the messenger is, I think is a challenge. And so that puts people at increased risk for exposure to violence in the sense that they're still out and about, but also increased risk of COVID-19 simultaneously. So we're fighting this kind of same fight on two different fronts. As far as trends, so most of you are aware that 2018 and 2019 each showed increasing numbers of both fatal and non-fatal shooting victims. 2020 was from the very beginning on track to be worse than 2019. And that trend has continued, if not worsened, especially in certain known hotspots throughout the city. So that's a problem because a number of our existing violence intervention efforts, the ones that are evidence-based that are on the ground, have been significantly reduced in their ability to do what they do because of the pandemic. And so it's a frustrating position to be in. There's been a lot of creative conversation about how this work can be done remotely or how different work can be created, but it's being done on the fly, and anything that requires in-person contact is a risk. So the trends are worse, I think, nationally and in Philadelphia, and our interventions are limited by the pandemic. So that's kind of the concerning overview. Not to continue fully in a vein of bad news, but I do also want to say that there are also concerns about the long-term impact of COVID-19 on gun violence. So firstly, the pandemic is unlikely to have a swift resolution, and the economic effects are likely to be sustained for some time. But also, there have been trends, for example, in the increase towards an increase in firearm purchases nationwide, but also in Pennsylvania, such that the instant background check system here in Pennsylvania crashed at one point because of the number of new purchase background checks that were requested. So that raises concerns about whether or not those guns will eventually end up on Philadelphia city streets and what we can do to anticipate and kind of obviate that problem. We're working right now on a timeline of COVID cases, COVID deaths, statewide, citywide, national city and state orders around movement and things like arrests, and then fatal and non-fatal injury. So we can kind of see how these things have been intersecting over time. But I think that the thing that everyone is motivated to do right now, speaking for the violence prevention kind of contingent in Philadelphia, and I think also people who do this work nationwide, is we have to be solutions oriented. This is going to require a lot of creativity, but it's also going to require a lot of, I think, institutional and political will. I think people are going to have to choose to prioritize this ongoing endemic health problem in the setting of this new emerging threat. We've heard some descriptions here in Philadelphia of trauma surgeons who are, resuscitating a trauma victim right next door to a COVID patient, and how that is an additional strain on resources and how that puts both patients at risk of not getting what they need. So we can't take our eye off one ball as we try to focus on another. And I think that's the challenge. And there are a number of ways that people have been starting to think about how to meet it, but I don't know that all the solutions are forthcoming yet.
I'm struck, just an observation, Ruth, not really a question. I'm struck by how much better off we would be if this were a few years down the road and the registry that you're trying to get together and the analysis that would enable us to do were in place, and there was real-time tracking of what some of the correlations might be. So just an observation that we really need your work. And this pandemic is showing that. And that's kind of a natural segue to Abby, because we really need the work of social emotional learning. Abby, you stressed in your opening remarks the importance of connection. And we're obviously in a place right now where the in-person, day-to-day, eyes-on connection has become impossible for teachers and school administrators with their students. So what are some of the district's efforts at this point to help students and teachers stay connected during the crisis? And again, including both the academic, but especially the social emotional connections that you've been working on.
Yeah, it's been pretty extraordinary from my perspective to watch. I've seen our district just embrace this challenge in a way that is really, I found it pretty inspiring. So the district recognizes the need for schools to be much more than places of academic learning, as I mentioned, and particularly during these times with students like ours who already had great needs. We recognize and we hear it every day from teachers, from parents, from students themselves, from principals. Students need their teachers now more than ever. And that building that connection with their teachers is how we keep kids engaged in school now. That means that's how we keep in touch and make sure that they're okay. That means that's how we make sure that their families are okay. That means that's how we make sure that they're getting food, that they're getting medical services. So we see that link, that connection as like the key to everything right now. So we are making pretty extraordinary efforts to support students and families and remaining connected and engaged with schools. So this includes efforts to expand existing services virtually, like to take what we were doing before and do it virtually. And in addition, developing lots of new services and support. So just as some examples, we're collaborating really closely with city agencies and the city, across the city, to identify and assist students who, for one reason or another, are not engaging in virtual learning activities. So our teachers and our schools know which kids are not showing up. Those kids who are not showing up, we make pretty extraordinary efforts to try and figure out why. We're working with the city on that. We're working with partner agencies like City Year, other groups that we work with that may be able to help us engage. We're working with our own staff in those areas as well. Like, what are different ways you can reach out to families? What are different ways you can reach out to kids? Have you texted them? Have you invited them to come to an online chat with you and find out what's going on with that child? In addition, we provide instructional resources to teachers every week that they can use for their academic content areas. And those supports include supports for students' social and emotional development. So every week, teacher clicks on a link. That link takes them to banded academic instructional resources and social emotional resources. So these include daily lessons and interactive activities that are related to identifying and managing emotions, coping with stress, setting personal goals, and many of thousands of teachers are engaging their students in these activities every single day. So that basically, there's someone in my office who coordinates our social emotional learning, and that person has just overnight become a one-woman curriculum development department, online curriculum development department. So we're also supporting counselors and teachers to ensure that students with emotional or mental health needs continue to receive services via linkages with community providers. There are school-based small group supports that kids were receiving during the year, and now we're providing those virtually. We've also developed and will continue to develop programming related to adults' well-being and mental health. So teachers, we have a partnership with a great organization in Philadelphia called the Introductory Foundation that provides weekly free mindfulness sessions for Philadelphia teachers. They can log on virtually and participate in these. They have a Managing Stress for Educators free online sort of course that our teachers have access to. We are creating trainings to help schools build stress relief and other adult supports into their regular operations. And as I mentioned, this is not going to stop when schools reopen. We believe that schools need to be supporting staff members to be healthy, engaged, happy, mentally supported people. And we believe that that's good for all students. That's the best thing for all students. So we're learning some of these things that we're learning to do now. We're going to translate back to our regular settings when school resumes. We're also doing things like today at 2 o'clock. Our family and community engagement supports office is doing a parent session on connecting school and home via social emotional learning. So we are working with other agencies or organizations within the school district to make sure that we're getting these resources and supports and this messaging around the importance of this connection and the social emotional skills and development during this time, just to sort of disperse that as widely as we can. Also in the area of mental health, we just announced this past week that we've partnered with the Center for Grieving Children's Uplift Center to create what we're calling the Hope Line, which is a hotline. There are therapists available who are English speaking, Spanish speaking. We're working on getting translation services available for anyone associated with the School District of Philadelphia to call if they're in crisis. And there'll be seamless integration with community-based organizations for follow-up care for those folks as needed. So these are just some examples of the kinds of things that I'm seeing happen.
Terrific. Thank you, Abby. And we'll come back to you to dig in a little bit deeper on some of that. I want to just turn to Vince, and I'm going to ask a sort of combined question, Vince. One is what we're learning. What is it? what is this crisis basically revealing about both this country and specifically Philadelphia's response to housing insecurity and the high cost burden that you talked about? And then based on what we're learning, when the immediate crisis recedes, how do we keep those housing issues central to the overall policy agenda?
Yeah, so I mean, and as I alluded to before, the one thing that's very clear is there are no housing safety nets, and it's often falls on localities to kind of manage the repercussions of that, right? And that translates into use of broader sets of public city services, right? From people who are facing housing instability that then, have other kind of negative outcomes in life as a product of that. I would say that what's interesting is a week before, like all of the closures in Philadelphia, the mayor had just announced the new innovative rental assistance program in Philadelphia. It was going to be 40 million over 5 years, 2 different forms of rental subsidy. It was going to target families with kids and a couple of other groups, and particularly have a youth focus to it actually. And it was a really tremendously innovative creation of rental subsidy program at a local level using local dollars. So acknowledging that there wasn't going to be federal support for this, so we have to do it locally, and the acknowledgement that because we're doing it locally, we're not going to be able to meet the full demand for this, but it's important to start making progress and set the precedent. And I think with that, there was an evaluation component that I was helping them on develop, and the goal was to build the evidence base again of this kind of broader set of repercussions of housing instability. And so in my eyes, the things that will make this persist is if we're able to use this moment to build on what we know already and create a new evidence base, but also build on people's kind of increasing personal awareness that housing is essential to every aspect of our life, right? And that housing instability particularly affects the lowest income households, and that this problem doesn't go away when COVID goes away, right? And so if we could build this evidence base of the positive impacts of rental assistance to households in moments of precarity, and how that translates to broader positive outcomes for kids and their ability to engage in online learning and succeed in school, for reduction in exposure to firearm violence in a pandemic or outside of it, and all of those kind of things. I think it kind of increases the case for why this needs to not just be a one-off response, and how this also needs to not only become a part of a safety net, but also be scaled so that it's actually a meaningful safety net that everyone can receive, as opposed to having to always rely on lottery systems where only a rare few can actually get the benefit.
Great, thanks. I'm going to pose a fairly broad question to all 3 of our panelists, and I think all 3 of you have touched somewhat on it, but I'm just going to ask us to have a conversation about this. We're seeing, many folks have said that the COVID-19 pandemic has exposed deep inequality and racial disparities and geographic disparities through how different populations have been impacted at different rates by the virus, by infection, and by death. So I'll be interested in each of your areas. What do we know about how COVID-19 and gun violence in the one instance, educational achievement in the other instance, housing security in the other instance, how COVID-19 and these issues are affecting different demographic and geographic populations? In other words, how are race and ethnicity and zip codes predicting the odds that someone will be affected by either COVID-19 or one of these other challenges? And what does that tell us about the legacy of inequality, disadvantage, and racism? And Ruth, I'm going to start with you again, if I could.
Sure. So I think that the geographic and the racial breakdowns in Philadelphia in particular, and in a lot of parts of the country, are interlinked. So just for context, we all know Philadelphia is about 44% white, 43-ish% Black, 15% Hispanic or Latino. So that's kind of the context in which we're operating. And when we start by talking about gun violence, and this has been a trend that's been true for years now, well over 50% of victims are young Black men, so less than 35 years of age, African-American males. Another 17 or so percent are Black men older than 35. And so in some, over 75% of those who are victims of gun violence are Black men. And similarly, perpetrators are the same demographic. So about 25%, about a quarter of all both perpetrators and victims of gun violence are anything else, right, other than a Black male. So that's the context in which gun violence has been happening in the city of Philadelphia for a long time. And when you look at maps year after year after year of shooting victims, both fatal and non-fatal shooting victims in the city of Philadelphia, the same spots have been lighting up for a while. And there's been some interesting work done by some of our colleagues right here in Philadelphia, looking at at redlining and historical kind of breakdowns of how Philadelphia advantage was, or opportunity was invested, and how that has manifested in disparities in health outcomes of various sorts, including violence, this many years later. So I think that is the context for gun violence, and that's been true all along. So when we switch to COVID-19, which is obviously a newer problem, it's a little bit concerning, of course, to see similar trends. So I'll start by saying for a lot of COVID-19 cases in Philadelphia, the race is unknown. And so I think the work of identifying the race of those who are unknown positive cases is ongoing. So that's about 20% of total cases right now. But of the total cases that we know of, about 46% of them are African Americans, so slightly higher than the overall percentage of the population that's made up of African Americans. And the next most common race is white, followed by Hispanic. And so there's definitely a little bit of concern as that data is emerging, and it is still emerging, but those trends are concerning. When you look at deaths, again, there is a small category of those that are unknown, but over 50% of those who have died from COVID-19 have been African American. So again, they're overrepresented in this population of those who are having the worst possible outcome from this disease. And that's been a matter of concern for a number of reasons. This, just like gun violence, I think is multifactorial. So I think that there are so many things that contribute to chronic disease, access to employment, safe housing, all of which are determinants for exposure to something like COVID-19. And they are also determinants of exposure to violence. So the same kind of intersection that we've been discussing this morning, I think we keep running up against it time and time again. If we choose to believe that violence, at least to a degree, is a communicable disease like COVID-19, then we can absolutely expect that certain communities are going to have easier spread of both, especially again if their infrastructure is not as robust. I also think that there are some early kind of preliminary but very sophisticated assessments that have been done of underlying conditions that make people at risk for COVID-19. And they're interesting, right? The ability to shelter in place broken down by race, the possession of jobs that allow remote work as broken down by race, the ability to move in one's neighborhood as broken down by race and by zip code, access to care, preliminary care, access to testing, right? A lot of what we know about positive cases depends on what we know about those who are able to get tested. And we don't know right now how testing is distributed throughout the city. So all of these things are likely contributing, but they certainly seem to bring up these same recurrent themes that we've been talking about, I think, this morning. And so that interconnectedness, I think, is important, because what it says is, whereas again, and I said this in the very beginning, it's so easy to say racism is too big, poverty is too big, we're not going to fix that, we're going to focus on this thing that we think we can fix. And I think what this epidemic brings out is we have to focus on the things we're focused on, but we can't refuse to tackle these bigger problems, because the next shock, whether it's a pandemic, whether it's any other major event that affects the world, that affects the country, is going to hit certain communities harder, always. And so we can't refuse to do the hard work and the heavy lift of addressing those deep determinants, because they keep cropping up. And they either affect a chronic endemic problem like gun violence, or a more acute, sudden problem like a global pandemic, but all of them are affected.
Great, thanks, Ruth. I'm gonna ask Abby and then Vince to respond, and then I see we've got a couple of questions, so I'm gonna ask Mark after that to choose a couple of those and share them with us. So Abby, your thoughts on this?
I really absolutely agree with everything that Ruth said. I think that what we're seeing in the COVID-19 crisis currently is an exacerbation of existing underlying disparities. So I think everyone's traumatized right now, just, you know, to a greater or lesser extent by the utter disruption and upheaval of our life as we know it. But I think that the communities that our schools serve are extra traumatized, in partly because of the level of trauma they were already contending with. I think that the housing situation, which obviously Vincent can speak to at much greater length, is affecting our, the population that our schools serve harder than anyone. I think that things like basic access to food, are one of the first things that we had to think about as a school district when the schools closed was, how are we going to feed hundreds of thousands of kids, hundreds of thousands of meals every single week when we're not allowed to, we can't even be near each other. So I think the hardships that all of us are facing, and I really like the way that Ruth said it, that our social distancing and our ability to work from home and all that is a privilege that is not distributed equally. I think that the challenges that all of us are facing are not evenly shared. And I think that the challenges facing people who are dealing with food insecurity, people who have uneven access to technology and the internet, those were underlying challenges that always existed that we need to continue to address, that are certainly being exacerbated and absolutely magnified by the current situation. I think in the area of kind of social emotional learning and that particular angle that I'm talking about here today, yes, this has been a big challenge for our schools. This is building relationships in schools and helping students build skills in emotional identification, self-regulation, goal setting, perseverance. All of those areas were key challenges that we were already facing, that we now see even more starkly.
Thanks, Abby. Vince, and then we're going to ask Mark to share some of the questions that the audience has raised.
Yeah, I mean, and actually, if you don't mind, I might actually even bring in one of the audience questions in my response here, because I think it relates a little bit, but you can kind of maybe expand on that beyond the. So it's clear, I mean, we're talking about disinvestment and disadvantage that disproportionately hit certain communities, and because of very well documented racial discrimination in housing programs and the way housing's provided and accessed, it's disproportionately hits low-income minority communities, right? And so in many ways, COVID is kind of another layer that's kind of layering on to those existing systems of disadvantage that are a function of long and persistent structures that we've had in place as a country, right? And so many of the realities that Ruth and Abby have highlighted are in some ways unfortunately not surprising, right? About who is kind of feeling the large share of the burden of COVID, because these are the same kind of communities that are receiving a large share of the burden of most of our shocks as a society, right? And not receiving the investment to kind of adequately recover from them. I would say this does kind of pose a question, though, for kind of thinking about how what we're doing is kind of advancing some of the efforts to help low-income and minority communities in Philadelphia and across the country. And so one of the things I've done in my project, Rashni had a question about getting on the ground information. I launched a survey that was just launched in conjunction with the Philly Rent Assist applications. It's an optional survey at the end that people who apply for the rental assistance can fill out. And we ask a robust set of questions about housing stability, about youth's ability to engage in schoolwork, about exposure to stress, to other health things, and the impact of COVID on moving. And so our hope is that that survey kind of helps take a lot of this kind of macro data that we're seeing at the neighborhood level and really kind of get to the individual level to further unpack how issues of housing insecurity and COVID are intersecting and affecting individual outcomes broadly. So I'm hoping that that survey will be well used. We've gotten a pretty high response rate actually already, and I think it's going to provide some really important and vital information about that intersection that Rashni is asking about and questions there.
Good. Thanks, Vince. I just have a quick observation before I turn it over to Mark. I think there's a tendency when we see the kinds of disparities that we're seeing with COVID-19 or with any of the issues that you're dealing with, to talk in rather broad and general terms about legacies of structural racism, about ongoing disadvantages, about inequality, et cetera. I was really struck, Ruth, that you kind of walked through in a step-by-step way. Here are, I can't remember, it was 5 or 6 structural barriers to people avoiding being infected by COVID-19 that have nothing to do with anything except structural barriers. There was a specificity that then leads us to say, so what do we do about those structural barriers, rather than as important as it is to call out racism where we see it, or to call out inequality where we see it. Too rarely we don't go to the next level that you went to, which is, what's the story behind the numbers? What do we know about this phenomenon, in this case, this pandemic, and about who's getting infected and who isn't? What do we know about why that might be? And again, I was pleased to see that you took us right to that level of specificity about which structures in which ways affect whom and how. And I think we just need to do a lot more of that in all the work that we do. So Mark, I know there are a few questions. Vince responded a bit to the one question about the extent to which any of the panelists are reaching out to young people on the ground to get their perspective. And Vince was talking about the surveys, et cetera, that's going on there. But other questions, Mark, that participants have raised?
Yes, and just to remind our audience, if you have any questions for the panelists, again, please just click on the Q&A button at the bottom of your Zoom window, and you can submit a question directly through there. So I think, like Vincent said, he answered the question from Rashni Stanford. Another question we have comes from Estelle Richmond. She writes, given that violence is a public health issue, are Philadelphia hospitals' emergency rooms reporting gun injuries to Philadelphia's Department of Public Health yet? If not, what do you think the reasons may be?
So that's a great question. It's an interesting question. So there's been a law on the books since 1995 mandating the reporting of shooting victim incidents by health systems to the public health department. There was some work done, I think, just before I started at the health department to see whether or not the rates that we get from police, which is actually our most reliable source of data on shooting victims and what most people, I think, in the city who do violence prevention work use, to see whether or not those rates are different from what's generally reported from health systems. And at that time, maybe that probably was done in the last 2 years, the rates were comparable. But many of you may be familiar with the idea of the Cardiff model, which is that certainly for violent injuries in general, shooting may be a little bit different, but for other types of violent injuries, hospitals may see cases that never are reported to police. And so if you look at maps of violent injuries as reported to hospitals and as reported to health, to the police, those may not be the same. And the health department may actually serve as a great arbiter of those two data sources to get a better look of what's going on citywide. So I'm not sure. There's a little bit of a question there as to the history of why that isn't done consistently. I think some of it is that it has been known in Philadelphia that the police have this data, and so people have relied on it, and that's created maybe a disincentive for health systems to take that additional step and make a phone call. But I think that it's powerful for two reasons. One is to create more robust surveillance. Are we sure that the numbers we have are the true numbers? Because most cases, not all, but most significant cases of shooting incidents present to a hospital. Let's make sure that the numbers continue to add up over time. So that's one important reason. The other important reason is to, again, continue to give more than lip service to the notion of gun violence being a public health issue. So other public health issues are monitored by departments of public health. And I think that's why my program was formed. And I think that having that necessary kind of data held in a place where the objective of the entire department is to improve the health of all Philadelphians is a powerful message. So for those two reasons, I think we have been very interested in restarting that process. That conversation has just started in the fall, but to your point, it's an old law. So it's an interesting problem.
Great. Thank you, Ruth. The next question comes from Stella Richmond again, and it says, has the School District of Philadelphia been able to cross-reference the students who they believe have not checked in with the Philadelphia Housing Authority housing, family homeless shelters, and other nonprofit partners?
So the short answer is yes, we're actively engaging with all of those organizations and entities. The longer answer is that, not much longer actually, is that I'm not leading that effort and I don't know all of the details of exactly who's partnering on that. I know that there's a concerted, multi-agency, ongoing, well-communicated effort to locate any students that are not engaging in school.
Great, thank you.
So I'm going to raise one last question and ask everyone to respond to it. I'm going to start with you, Vince. And because you had kind of had a heads up that a question like this might be coming your way, and that'll give Abby and Ruth a chance to either formulate an answer or formulate a way to tell me, it's not a very good question for you. But clearly, the pandemic is having huge health effects. We also know that worldwide, the effort to respond is going to have long-lasting economic effects. It's going to have effects on city, state, and federal budgets. It's going to have effect on employment, on industry. We really don't know yet exactly how this is all going to play out. But in any event, we do know there are huge economic effects. And we also know that there's a national election coming up in 6 months. And regardless of the outcome of that election, we know that there will be a new Congress. And whether there's a new administration at the federal level or not, whenever, even if it's the same administration, when a second term begins, there's kind of a reset that happens. So I want you to imagine that you're sitting at your desk and the phone rings, and it's someone from the new administration or from a new congressman or senator's office, and they're saying, I heard that you're an expert on housing policy. We've just been through, or we're in the midst of this COVID-19 pandemic. You've been studying the impact. Based on what you've learned and based on the economic challenges we're facing, what do you recommend? What are your 2 or 3 big ideas that you think we should be thinking about as a country as we move into, again, whatever happens after the election?
I'll offer 2 ideas. One, I would say, isn't actually my idea. It's been around for quite some time. Ed Olson, who's an economist at University of Virginia, has kind of floated this idea for quite some time, which is the idea that the Section 8 voucher should not be lottery. It should be a safety net that's as of right if you're below a certain income, right? That should be a very base point. It's not a perfect program, but the reality is the fact that 10,000 households are currently waiting on PHA's waiting list for a voucher. Working in LA, they opened up their voucher lottery for the first time in maybe 20 years. 180,000 households applied. Of that, they randomly selected 20,000 households to be put on a waiting list. Of that, they were only offering people vouchers as the people stop using old ones because they don't actually have new budget authority for that. That is a travesty, right? And so the idea that something like Section 8 vouchers are a fundamental right and a part of our safety net is something that can and should be done. This idea that's floated for some time that hopefully will get some traction. That said, that program isn't perfect, and we should acknowledge the very nature of this call, which is that housing is related to a broad set of outcomes. And I do think that the conversation we're having here is something that should be promoted and encouraged and kind of supported financially at a federal level to promote that connection between housing and a broad set of outcomes. So Ruth and I have been recently kind of talking about the relationship between vouchers and fire exposure to firearm violence, right? And so when you create a voucher program, how about you structure it in a way that kind of helps reduce people's exposure to firearm violence and really kind of maybe increases the generosity of a voucher in ways that kind of incentivize and reward and promote and mostly allow people to actually access these neighborhoods with lower firearm violence, and the acknowledgement that the housing stability alone is one piece, but also the exposure to kind of these broader set of outcomes is another kind of fundamental piece. this. And so I think that kind of thinking is often hard to do because we're all in our silos, right? And at the end of the day, the funding structures really kind of reward just those silos. And so I think at a federal level, kind of meaningful funding mechanisms that acknowledge this connection and kind of reward it financially through new programs and support for existing programs and ways to reach across those silos, I think is really kind of fundamental for viewing housing stability as a key to kind of these broader set of youth and just overall household outcomes.
Good. Thanks, Vince. We only have a few minutes left. I want to ask Ruth to weigh in. Same question, phone rings, and it's someone who wants your best ideas in your area of work from the standpoint of a national strategy. You're muted, Ruth.
Thank you. So I thought of three things. So the first is data, which is obviously something that I feel strongly can empower actionable change, and part of what my project is all about. So there are huge holes in what we know about everything about a gun. If you think about the life of a gun from its manufacture to the point where it ends a human being's life, there's a lot we don't know about the transitions that it makes. There's lots we don't know about those individuals. There's a ton that we don't know about non-fatal shootings, for example. That's a huge hole in national data. So if you want to fix the problem, you have to be able to describe it. We can't fix what we don't know. And so federal investment in firearm injury and death data beyond just borrowing from what's available in health systems and police departments, I think is critically important. I think scale, so there are existing firearm prevention efforts that have been shown to be effective in Oakland more recently and in New York, and they all are tweaked for their localities, but they work when done properly. The problem is that there hasn't been any, I think, federal incentive to scale them to effect and then provide oversight. So if you have a program that works really well, and it's worked well in Oakland, and it's worked well in parts of Chicago, and it's worked well in New York, and we're serious about reducing gun violence, then let's scale it to effect, let's fund it properly, and let's provide oversight. And I think that could be done at a federal level, and that would make sense. And then the other thing I just want to mention, it's really not, I think, my area of expertise, but I want to mention it anyway because it's a trend we see, is the criminalization of youth. So I think that when very young Black men get in trouble in their school-aged years or get in trouble in part as their response, frankly, to the trauma that they themselves are exposed to, criminalizing them at a young age sets them on a path that's very hard to reverse. So this is already, I think, something that people understand to be a massive problem, but I think that's a very important thing. So as we are starting to see early stories of those who are both victims and perpetrators, a lot of them have really young involvement with the criminal justice system. And I think that how we play that could completely change the trajectory of these young men's lives. And so I think that that's an important thing that could be taken on at a federal level.
That's terrific. I can't stop myself from commenting. That's sort of the field that I work in, and I can't stop myself from saying that whether federal, state, or city, or foundations for that matter, there's a whole lot of interest and focus on adult criminal justice, deservedly so. It's a lot harder to get people to really pay attention to the youth justice piece of that, including the complete diversion, as you say, to decriminalize the complete diversion of young people who have, might have a behavior issue, might make a bad choice, diversion from a justice response to a community response. So it's a paid advertisement. So Abby, your thoughts on this?
So I first want to, I think, build off a little bit or link to what Ruth just said. In that I think that understanding this issue of criminalization of young children as connected to discipline in schools, as connected to the environment and climate of schools is a really critical thing. And I think that we need to continue. I think this conversation is definitely, being had and has been being had for a number of years. And I think we need to keep up that fight, which is to help schools find ways to think about discipline and to think about school climate as non-punitive and non-exclusionary, and to think about the role of school climate as supporting engagement and connection. So kind of related to that, going off of that, I think we need to continue to elevate this conversation about making schools centers of connection and engagement. And I think there are a few things that we could do to help support that. One would be, there are states that have adopted social and emotional learning standards that sit alongside their academic standards. So this is really elaborating what students should know and be able to do from a social and emotional standpoint at various grade levels. Kind of spells out that development process that we would expect to see for kids that are experiencing healthy social and emotional development. And that part of the role of schooling is to actively facilitate that development, not just as a sort of 20-minute program that you do once a day, but throughout the school day alongside and connected with, and as a way of making academic instruction more engaging and more meaningful. I also think that we need, and I see glimmers of this, but I think we need a broad research agenda that is attached to funding from major funders around building relationships in schools. What are the effective ways of building relationships in schools and building a sense of connection in schools? And how can we see that happen more widely? What are the barriers to implementation of the approaches that we are familiar with that we know can be successful? And then additionally, more research and more work around supporting adults. We need happy and healthy teachers. If we don't have happy and healthy teachers, we're never going to have happy and healthy students. So I think those are kind of three areas that I would love to see more support at sort of a policy, at a funding level in helping to drive our schools in the right direction.
Terrific, thanks. We're just about at the end of our time. I don't know, Mark, if Ronnie Bloom is on the line, or Marie Williams. I know we wanted to give a chance for folks from Stoneleigh to have some closing remarks.
Yeah, she should be joining us in just a moment.
Okay, so while we're waiting for that, I'm just going to thank our incredible panelists. This is a wide-ranging conversation. We could have spent a lot more time with just one of you and all the exciting work that you're doing, much less three of you. But I think your messages were reinforcing and certainly has me thinking a lot about the different things we ought to do. I see Ronnie has joined us. I'm going to turn it over to Ronnie.
Thank you, Patrick. And thanks to all of you for joining us. I think this was an incredibly rich and really important set of conversations and discussions that we heard today. We really feel at Stoneleigh that raising the questions, the kind of questions that you heard, and really pushing for solutions is core to our mission. I do see that a few folks did not get to have their questions answered. So please be in touch with us at Stoneleigh. We're happy to put you in touch with any of our panelists to continue this dialogue. I do really want to give just a huge thank you to Patrick McCarthy, our visiting fellow. Many of you may know Patrick from his long career and his leadership at the Annie Casey Foundation, and he's been incredibly helpful to us at Stoneleigh in thinking about our work, and of course in organizing this panel today. And of course, I absolutely want to express a huge amount of appreciation to our panelists, to our fellows, Ruth, Vince, and Abby. We really, really appreciate all the work that you do and really your willingness to share your insights with everyone. We will continue to host these kinds of virtual convenings throughout the summer, so we hope that you'll continue to join us. So stay tuned, and we will look forward to seeing you again. Stay well, everybody. Wishing you all the best.
Take care. Thanks, everybody.